Hey there, Dr. Glenn here, and today we've got a really great webinar for you about autoimmune disease and the best test on the planet for screening for autoimmune disease. And we're even going to talk a little bit about the things that cause it and how you can reverse autoimmune disease. So take just a moment, if you would, and silence your cell phone. You might want to close any apps on your computer. Close the door if you need to, and just set this time aside for you. And it's really going to be worthwhile in your health journey. So take a moment, if you would, type in the chat box where you're from, whatever health challenges you have, things like that, how you heard about us. A lot of people from Virginia, some people from Texas. We used to have a clinic in Texas. Yes, thank you very much. People all over the place. There's somebody there from Australia. Got a couple of people from Canada. That's great. And several of you are saying Hashimoto's, some of you lupus, okay? All right. It's, Hashimoto's, that's the most common autoimmune disease, and you can actually reverse it, even though that's probably not what you've been told. Some people ask why I do this. I do this because I love to see people get well, and it bothers me that so many people are victims of an outdated healthcare system. So I love to see people get well. This is one of our patients, Shay. She had thyroid issues. She lost a lot of weight, and she was able to actually stop taking her thyroid medication. I'm Dr. Glenn. I've written several books about functional medicine. We have an office in Reston, Virginia, in the Plaza America, right next to the Whole Foods. And so we have a lot of patients from Northern Virginia. My office is just on the other side of that picture there, and the next door down, that is our certified holistic nutritionist, who a lot of you will be able to talk to if you would like. And but we also see a lot of patients from around the world, what we call virtual patients. And we can do just about everything that we can do online. So you don't have to live local in order to let us help you out. I love to teach. I graduated from Baylor in 1979. I taught electrical engineering for several years. Decided in the mid-'80s I wanted to go back to school and become a doctor. I've done a neurology residency program. I've done a lot of training in functional medicine and so on and so forth. So this webinar is for you if you have an autoimmune disease, and that includes Hashimoto's especially. If you've been told there's nothing that can be done. You know, that's what we used to think. That's what I was taught when I was in school. If you've tried all kinds of supplements, if you're tired of taking drugs with no hope in sight, if you're frustrated, if you know that there has to be a better way, then you are exactly where you need to be, because there is a better. One of the things that I'm going to do today is, as we go through the webinar, I know that there may be some of you who can't stay for the full webinar. So I'm going to just go ahead and put a little button over to the side that if at any time you'd like to go ahead and click that button and schedule with us what we call a free discovery phone call. And what that is, it's usually it's about a 15-20 minute phone call where you can talk to one of our team. Usually it's Lenine. She's our certified holistic nutritionist. And you can ask more questions about what we do, about whether or not we take care of people with whatever is going on with you, the kind of results we get, and you can just find out a bit more. And also, Lenine will ask you questions to find out and make sure that we're the right place for you. So I'm just going to leave that button up over on the side. And if you want to go ahead at any point during the webinar, you want to go ahead and just schedule that free discovery phone call, please go right ahead and do it. Also, when we get to the end, I'm going to show you the most wonderful new test that's out where you can screen for autoimmune diseases years before they become symptomatic, and you can pick them up way early, which makes it even more likely that we're able to reverse them and get rid of them. But I'm just going to leave that up for you over there on the side. So tell me, why are you here today? I know some of you have typed in, your condition, lupus, Hashimoto's. Got a few people with scleroderma. We see that. Okay, MS. Yep. Dr. Terry Walls, she reversed her MS and she was able to get out of the wheelchair. It's amazing. Before we get started, I want to ask you if you're committed to Well, to what? Well, I want to ask you, are you committed to doing what it takes to reverse your condition if you can be shown how to do it? Then I'm going to ask you to stay with me until the end. We have a wonderful opportunity for you today to use a screening test by a company called Cyrex. It is absolutely the best test in the world for picking up autoimmune diseases long before they become symptomatic. You're going to want to take advantage of that. So whenever you're going to try to reach a goal, the first thing you have to do is start with the end in mind. There's the old saying that if you don't know where you're going, any road will do. Well, if you know where you want to go, then what we have to do, and I put a little picture up here, and that may be where you want to be, but you may want something else. You may want a hammock on the beach someplace, and that's just fine. But in order to get to where you want to be, you have to have a realistic evaluation of where you're starting from. And once you know where you are and where you want to go, then the challenge is just to figure out how to get you from where you are to where you want to be. And that is what we specialize in functional medicine, is identifying your root cause and then being able to come up with a way of getting you from where you are to where you want to be. Another reason I do this is I see things like this all the time. I'll add them up for you, but this person is taking over 42 different supplements and dosages per day. This is just throwing supplements at a problem instead of actually reversing the problem. And I see people like this. Raise your hand or just tick in the chat box if you've been down this road where you have just taken a ton of supplements just chasing your symptoms around but never actually getting things fixed. Good healthcare is not about taking the right supplements. It's about fixing the underlying systems so you don't need the supplements. Everything we're going to talk about today is in the literature, and I'm just putting a couple of journals up here where it talks about the different things that we now know trigger autoimmune disease, and we're going to get into that as we go along. There is a new movement in medicine right now, and it's called functional medicine. And it's actually the fastest growing segment of medicine. And in functional medicine, what we do is we focus on the root cause. And the root cause will affect a body system. And then when you affect a particular body system, you'll end up with certain symptoms. Now, our current medical model is based on a 20th century idea where you manage the symptoms by using drugs. And that's great for the drug companies, but it's not great for the patient, because what happens is you don't ever get well. You just keep on changing drugs and changing dosages, and that doesn't lead to good health. What we want to do in functional medicine is find the root cause of the problem, because if you can figure out what the root cause is, that's the first step into reversing chronic disease. What we mean by root cause is, you see here above the ground level, we have the names of things: cancer, thyroid disease, depression, diabetes. You can read them all there for yourself. Below the ground level, we have the causes: inflammation, toxicity, all kinds of things like that. In functional medicine, we want to focus on finding the root cause, because if you can find the cause, then you're on your road to fixing the problem. So it's not about what you have or the name that it's given. It's about why do you have it? Because we want to find the why. So let's talk a little bit about what we call the progression of autoimmune diseases. And a lot of you have seen this. You start off with no symptoms at all, and then all of a sudden there's some kind of a trigger that comes along. And it can be any one of those things that's listed: food sensitivities, leaky gut, all kinds of things. And the next thing you know, you'll start developing an occasional symptom. And you don't think much about it. You think, oh, I've just come down with a little something, or I ate something that disagrees with me. But as time goes by, you might mention it to your doctor. So let's just say you've got something like reflux, or something like that, which is actually a symptom of a thyroid problem. It's not too much stomach acid, but that's what we've all been told. So you mention it to your doctor, and maybe he gives you something. He says, well, take this whenever you need it. And so you do that, and you start off with that, and time goes by, and the next thing you know, now you're having a few mild symptoms a little bit more often. So what do? Well, you change the medication, or now you start taking something every day. Well, the next thing that happens is the symptoms start to become more regular and a little bit more severe. So what does our system do? It sends you to some kind of an ologist, some kind of a specialist, rheumatoid, gastroenterologist, endocrinologist, whatever it is. And the problem is these people, they don't talk to each other. So now you're getting more and more specialized and farther from the root cause. So what happens? Now the symptoms become more and more severe, and you change your medications or you add more medications. And then the next thing you know, you're told that you have an autoimmune disease. And if you're told that you have an autoimmune disease, you've probably been told that there's nothing you can do about it and that you just are going to have to learn to live with it. How many have you been told they're going to have to live with it and there's nothing you can do? A lot of you are raising your hands and saying, yes, me too. All right. One of the things that you've probably never been told is that having one autoimmune disease actually triples the risk of developing other autoimmune diseases. And in just a minute, you're going to see why. This is another way to look at this. You start off down here in the green where you're healthy, and then some trigger comes along, and it could be one of those or something else. And the next thing you know, you start developing a little problem, and you're not really symptomatic yet. Then you start to become symptomatic. And this is sort of where the diagnosis gets put on you, whether it's lupus, Hashimoto's, whatever it happens to be, irritable bowel syndrome. It doesn't matter what the label is. This is the progression. And the next thing you know, you're down here where you're told nothing can be done about it. Look here over the last 50, 60 years. This is what's happened to infectious disease. When the current medical model came into existence in the 1950s, most people's problems were infectious diseases. Rheumatic fever, hepatitis, measles, mumps, all these things. Well, since they've developed medications for this stuff has all gone down. But here's what's happened also over the last 60, 70 years is chronic diseases have gone up. And you'll see Crohn's, multiple sclerosis, these things. There aren't any drugs to fix these. There are only drugs to manage these. This is great for the pharmaceutical companies, but it's not good for your health. I want to talk about something else here too, and that is females tend to have a much higher incidence of autoimmune disease than males do. And one of the reasons is because women have more triggers than men. And we're going to talk about those in just a minute. But you can see that there's actually only one autoimmune disease, and that is diabetes. That's right, diabetes is an autoimmune disease. And there's only one of them where men outnumber the women. So what causes autoimmune disease? Well, this is something that I call the perfect storm, and this was first published in 2009 by Dr. Alessio Fasano at Harvard. And he has said that in order to have an autoimmune disease, the first thing you have to have is you have to have a genetic predisposition. All right? Now, that doesn't mean that the gene is turned on. It just means it's there and it can be turned on. Now, in order to turn the gene on, you have to have two other things. The first thing is a leaky gut, and the second thing is an environmental trigger. And when you have those three things together, then you have the possibility of turning on an autoimmune disease. We're going to talk about each one of these. The genetics you can't change, but the leaky gut and the environmental triggers, those can be changed. So let's come over here and let's talk about genetics for just a moment. When I was in school, and maybe even when you were in school, we were told genetics, they're what you got. There's nothing you can do about it. If you don't like it, you should have picked different parents. Well, there's a whole new field in biology now, and that's called epigenetics. And epigenetics have shown that autoimmunity is only 25% heritable, which means that the environment is far more significant, 75% to be exact. Epigenetic modifications are reversible. That is a key word right there. They are reversible modifications to a cell's DNA or its genes, and that affects the expression of the genes without altering the DNA. And as I like to say, you can't change your genes, but you can turn them on and you can turn them off, and that changes everything. This has thrown the entire autoimmune community on its ear because we were taught you can't change these things, but the new science shows that these things can actually be changed. So let me show you kind of what does this whole thing mean? Well, you can see this is a floor plan of a house. And the floor plan, think of it like your genetic structure. This is what you got from your mom and dad. Now you'll notice that in each one of these rooms, there is a ceiling fan. And the ceiling fan is wired. You can see the little wire goes right over here to the switch. This one's wired right here and wired right there. The floor plan allows for the fan to be in the room, but it doesn't determine whether the fan is turned on or turned off. And this is what we mean by epigenetics in autoimmune disease. You might have the gene for an autoimmune disease like Hashimoto's or MS or something like that. But just because you have the gene does not mean that it has been turned on. An environmental source like a person, let's say you, walk into that room and turn that fan on, you're not a part of the genetic makeup. You're an outside force. You're an environmental force. And if you turn the gene on, you can also turn the gene off. And that is where everything has changed over the last few years. One of the other things that you have to have in order to have an autoimmune disease is a leaky gut. Now, this talk isn't about leaky gut, and I have other videos and webinars and things about leaky gut if you want to know more about that, but chances are you've probably heard about it. So a leaky gut is an intestinal permeability, and that's when the lining of the small intestine can become damaged, and that lets undigested food particles, toxic waste products, and even bacteria, good bacteria, from the gut to leak through the intestines and flood the bloodstream. These things are not supposed to be in the blood. So think of leaky gut like a coffee filter. Down here, this is your blood. This is where you want the coffee down here. Okay, up here, you've got the coffee grounds and you've got a filter in this holder right here. And that filter's only supposed to let the coffee through, but not the coffee grounds. Now, if someone came along and poked a hole in that coffee filter, you would end up with stuff in your coffee that you didn't want. And when stuff gets in your coffee that you don't want, you would have a reaction to it. When things get into your blood that are not supposed to be there, your immune system reacts to that. And when it does, it creates an antibody that goes out and attacks it. And the thing is there's only so many different shapes of proteins and things around. And so if a protein for something gets into your blood and it happens to look like a piece of you, you could have just turned on the gene to attack that part of you. If it's your thyroid, it would be Hashimoto's. Now, I want to do a few case studies so we can show you how we take care of things in our office and how these things can be turned around. Now, this is Betsy. She had a case of what's called transverse myelitis, and that's an autoimmune disease. And she's 65 years old. She actually came to the office in a scooter. She was no longer able to walk. She had lost the ability to walk due to the autoimmune disease that was affecting her spinal column. You know, and these are serious diseases for which there are no drugs to fix them. She'd seen a bunch of therapists and specialists before coming to the office, and during some online searches, she discovered functional medicine and later found out about our office, and she attended one of our workshops, which are kind of like this webinar that we're doing right now. And she had felt like she had tried just everything. So she came in. We did a good evaluation of her. We figured out what was going on with her. We ran the right test. She had a very supportive husband, which is very, very important. She had a positive mental outlook. Her energy was not where she wanted it to be. She used to be a really energetic and go-getter kind of person. And she has also been having some digestive issues for quite a long time. This was the email from when she came in on September the 30th. She was paralyzed from the chest down. She had some function in her arms, but they were affected as well. So we put Betsy on a special AIP diet. That's an autoimmune paleo diet. It's not the only diet that we use, but it is one that we do use quite often for a lot of people. We also use some specially formalized herbs and supplements and things to get her gut health and all of that normalized and back to where it's supposed to be. Got her mitochondria functioning properly so she could create energy again. And she also saw an acupuncturist and did some physical therapy. And this is just 3 months later. She was walking again. This is what makes it all worthwhile. She says in an email, I walked today. I truly walked. My whole body responded. I'm beside myself with joy and gratitude. And I've been working very hard in the gym along with all the other pillars of health. Thank you, thank you, thank you. You know what? This is what makes the whole thing worthwhile. Let's do another case study. This is Alex, 43-year-old female. She had rheumatoid arthritis. That's another autoimmune disease. She was very high stress. She complained of chronic GI issues. You're going to see how this GI thing keeps on coming up because in order to have an autoimmune disease, you have to have a leaky gut. That has been proven in the literature. So she had GI issues that had started years before. Well, of course, it takes years for autoimmune diseases to become symptomatic. She had certain foods that would make her stomach pain worse. She complained of IBS-type symptoms, and the doctors really had no answers for her. They couldn't figure anything out. She even had GI scopes that came back normal. Well, of course they come back normal. You can't see the cellular level on an upper or lower GI. And she reports that she feels better when she travels back home to Romania. I'll bet you the food is different in Romania. We did a stool test on her. Look at this. She comes back. She's got Cytobacter. That's a bacterial infection. Okay, going on. She's got a Candida yeast overgrowth, and she's got secretory IgAs. Those are low. SIGAs, that is the first line of your immune defense. They're low, so her immune system is not up to speed, and she has anti-gliadin secretory IgAs, and those are high, and that right there means that she has an autoimmune disease. She has an antibody to gluten. We ran a Cyrex Array 2 on her. We're going to talk about Cyrex more in just a little bit because they've come out with this brilliant new test that we're going to show you in just a little bit. But she actually had lipopolysaccharide antibodies in her blood. These should not be there. The only way these can get there is if you have a leaky gut. We put her on an AIP diet. We got rid of the gluten, nuts, and dairy, got her on some herbal protocols to heal her gut infection, sent her back to the MD and had her placed on something to kill off the Helicobacter pylori. She was given high doses of essential fats and get her inflammation down, and we got her to stay active. And 3 months later, her leaky gut is healed. Now, we see this all the time. A lot of people have this idea that if you have a leaky gut, you're going to have it the rest of your life, and that is not true. If you do the right things, you can heal a leaky gut within just a few months, and you just have to know how to do it, and we do it all the time. This is what she said. She was a blog writer, and she was talking about how the tests that we ran, that they showed that she was severely reacting to gluten, an overgrowth of bacteria. She had a parasite called Helioblasticystis hominis. She had massive H. pylori infection. She had an overgrowth of Geotrichium yeast in her gut. She was insulin resistant, so she was starting to develop prediabetes. She wasn't digesting her carbohydrates. Severely amino acid deficient, severely B vitamin deficient, problems with neurotransmitters. She was depressed and no motivation. And of course, medicine's answer to depression is to give you an antidepressive drug, not to fix your depression. Depression is fixable. We do it all the time. She was handling stress poorly, and she was having trouble detoxifying. She had an intestinal bacterial overgrowth, lots of inflammation. She had insufficient enzymes to break down her food, and her immune system was very compromised. These are all things. She started a blog after she was healed and went back and talked about all these things that got fixed. She told about them in her blog, and this is all copied from her blog. This is the kind of person that we see all the time. Now let's do another case study. This is Cheryl. Cheryl's a 43-year-old female with a long list of health challenges, and she remembers battling weight issues her entire life. She'd been diagnosed with hypothyroidism, endometriosis, and depression. Big-time stressful job. We see a lot of that in the Washington, D.C. area. Her memory was so bad she couldn't remember where she parked the car, and she was shocked when she saw 300 pounds on the scale. This is from Cheryl's intake form. You can tell she'd felt like something was off for many years. Her body hurt all the time, especially her back, unable to lose weight, fatigued, restless, heartburn, that's her thyroid. Her period was completely screwed up, that's her adrenal glands. She gets angry and emotional, so she's not making neurotransmitters. She became anxious and worried. No motivation, and so on and so forth. She would get down on herself for being lazy and not being able to stick to things, and lack of willpower and being unambitious. Got bitchy. Well, when your emotions are on the edge, you do get that way. And she felt stupid because she couldn't remember things and she couldn't find her car. And because she blamed it all on her weight, because nobody would listen to her and actually let her talk about how she felt. And so she continued to think that it was all down to weight, it was all in her head, and that she's losing her mind. And a lot of you have probably felt that way. If you want to raise your hand in the chat box, that's fine. But this is the kind of person that we see all the time. We ran some chemistry on her, some blood labs on her looking for antibodies, and guess what? She comes up with thyroglobulin antibodies at 6,200. They're supposed to be less than 41, and thyroid peroxidase was above 1,000, and they're supposed to be less than 35. As a matter of fact, they were so high the lab couldn't even measure them. So this person has an autoimmune disease that is attacking her thyroid, and that's called Hashimoto's. We also ran the organic acid test on her and checked this one out. This is way too high, so she's not doing well here. Energy production is off. And let's meet Cheryl and see what she has to say.
Cheryl, if you want to first start by telling us what brought you into our office.
Well, there were many things that brought me in. I did not feel well. And by not feeling well, I mean I had lost my love of life completely. I didn't know what I was doing every day. I couldn't concentrate. I couldn't focus. I had no stamina. I would leave a store and I would walk around the parking lot crying because I could not find my car, and I was pretty sure I had Alzheimer's, and I was scared. I was very scared because I didn't know what was wrong with me. I could not keep my emotions in check. I was crying all of the time and I didn't know what to do.
Well, what did you try prior to coming in?
Prior to coming in, I had based all of my issues on weight, and I just figured I was overweight, so all right, I was having issues, and I did all the usual LA weight loss and Weight Watchers, and nothing ever helped, and it didn't help the weight loss, and it didn't help any of my other symptoms. I had watched a video online where you were interviewing someone who the name escapes me right now, but you were talking about functional medicine, and a bell went off in my head, and I thought, there's my answer. There it is right there.
Awesome. So what did you find different about this approach compared to some of the other things you tried?
Absolutely everything. There was understanding, and instead of just, hey, go do this, it was, we'd like you to try this because these are your issues. Like all the testing and everything that it showed, things that I had no idea about. Finding out about Hashimoto's was absolutely huge to me, and it just, the understanding that you have and your ability to explain things on very clear levels, it made so much difference to me, because I left here after every appointment going, I understand and I know what to do now. I know what I have to focus on.
Awesome. Can you share some of your results?
I can leave a store now and not think about where my car is, which might not sound like much to some people, but it's huge to me. I have a love for life that I can't remember the last time I had. I want to be outdoors. I love nature. I want to exercise. I want to be mobile. I want to move. A byproduct of all of this has been a better relationship with my husband. We're both just more understanding about everything, and a huge part of it is I have lost 105 pounds since I started here last July. And I know that it's not all about the weight because so much of it is up here, but the program as a whole has just given me back life that I didn't think I would ever have again.
What would you say to somebody who's kind of sitting on the fence, maybe on the other side of the computer screen watching this and unsure about taking that next step?
Don't hesitate. Don't hesitate, because the results that you will have will blow your mind.
Now, isn't that a fantastic story? Now, and wouldn't it be nice if we could do the same thing for you or for one of your loved ones? You know, you may be asking, how do we identify this process before it turns into something more severe? It's really important with autoimmune diseases to catch these things early. You know, they can be developing for anywhere from 5 to 10 years before traditional lab testing and traditional diagnostic criteria will pick these things up. So the way that you find this early is, first of all, you have to ask the right person, the right questions, and then you have to do the correct testing. So what we do in our office, I'll just give you a little overview of this just so you kind of have an idea of what we do. Down here in the right there, you'll see we have what we call our initial consultation. And that's where we spend a good hour and sometimes even longer deep diving into what is going on in people's health. So we can start to find those root cause problems that are going on, and we can start to find those triggers. Once we do that, then we decide what lab testing we're going to run. And while we wait for the labs to come back, we will do a lifestyle and nutrition consultation. And when your labs come back, we do a lab review, we go over everything that's going on and so forth. And then we just march through the program. And I just wanted to show you that so that you know that we have a very well thought out protocol for how we do this, but that's not what this webinar is really about. I wanted to talk a little bit more about the different kinds of tests that can be run, especially this bottom one here, the Cyrex Array 14. Now, the Array 14 is a fairly new test. You know, we saw some of the organic acid tests, and we also saw some of the GI map, the stool test, and the information from those tests is absolutely fantastic. But the Cyrex Array 14, you can see here, this is actually a saliva test, and it is way more sensitive in picking up these autoimmune situations long before traditional testing will pick them up. And you can see here all of the things. This is actually a woman that came into the office, and she was feeling pretty healthy and thought everything was going fine and thought she just had a little bit of a thyroid problem with Hashimoto's. We ran this test, and you can see all of these guys right here are showing up as antibodies to different parts. And if you come over here, we look there, this ASCA and the calprotectin, these are antibodies to things that are going on in her gut. The alpha gliadin, gamma gliadin, glutenin, come on down here to the gluteomorphin and the wheat germ agglutinin and the transglutaminase. Those are all markers for different types of gluten problems. This is way more accurate and way more sensitive than the old celiac testing that used to be done. And unfortunately, a lot of doctors are still doing that test because they don't know about these new tests. You can see that this test also tells her that she has a problem with eggs. She has a problem with soy. She's developing a problem to corn, so we can get a lot of cross-reactive proteins going there. Come on down here, aflatoxin, that's a mold that can be on peanuts and things like that. Bisphenol A, that's BPA. That's like the lid on your Starbucks coffee. Don't put lids on hot liquids that are made out of plastics, because that hot coffee will condense on the bottom of the lid and then drip back into your coffee, and you're drinking plastic. This one, you can test for mercury and heavy metals. She's okay there. This one right here shows a rotavirus, which is a chronic virus infection. Myelin basic protein, that's what you see in multiple sclerosis. The blood-brain barrier, wow, that is a really big one nowadays, especially if a person is having brain fog or cognitive decline issues. And so this is a wonderful test. It's a saliva test. You actually can do this at home, and we have the kits right in our office, and you can pick up one of these kits and you can do this test. Let's go over here and talk about what functional lab testing really does. Functional lab testing, these tests, they reveal what conventional testing does not reveal. Conventional testing is your typical blood panel. It doesn't show you anything about energy production. It doesn't pick up, parasites and things like that in the stool like it should. And it certainly doesn't pick up antibodies as early as these other tests will pick them up. The key to solving these autoimmune situations is to pick these things up way early. As a matter of fact, I'm going to go right out here and say, you know what? If you're over 30 years old, you should run one of those saliva tests, even if you don't have anything else going on. You're not signing up to become a patient. You should just run a saliva test every now and then just to see what's happening, so you can pick these things up before it's too late. Functional testing explains why things are happening and not just what is happening. You need to know why you have the problem, not what it's called. With the correct testing, you can pinpoint exactly what needs to be corrected and measure the success of the treatment, because you can come back in 3 to 4 months later, retest, and make sure you're getting things fixed. And traditional testing names the result while managing the symptoms. And by then, it's very often too late. That's what traditional testing does. I actually had a woman come into the office a couple of weeks ago, and she has 2 of the markers for lupus. And the doctor said, well, I can't call it lupus yet, even though I know it is. We have to wait for a 3rd symptom to pop up before you tick enough boxes for us to call it lupus, and then I can start treating you. And I'm just thinking, oh my gosh, you have got to be kidding me. You're not going to catch this early. You're going to wait until you can tick all the boxes before you start treating something. That is not right. That is not good quality care. So tell me, type in the chat box there, has this webinar been insightful for you so far? Have you learned some things? Have you learned, the 3-legged stool of autoimmune? You have to have the genetics, but you also have to have the leaky gut, and you have to have the trigger. Of course, the obvious question is, how do you put all these puzzle pieces together so you can start feeling better as soon as possible? This can be really overwhelming. And, you can read all about this stuff as much as you want to on the internet. But it really takes somebody who knows how to put these puzzle pieces together. So what we have for you is we have a little solution to this for you. Now, you have a choice. You can either do things the way people typically do them, and that is either going to doctors who don't know how to answer the question. That's not good. Or you get on the internet and you start reading and reading and reading, and the next thing you know, you become so overwhelmed and confused that you just are paralyzed with indecision because you don't know what to do. Or we've got a very simple and strategic plan for you, an option for you here, and it's what we call a free discovery phone call. Now, and it's exactly what it is. It is a free phone call with a member of our team. As a matter of fact, the person you'll probably be speaking to is Lenine, and Lenine is a certified holistic nutritionist, and she usually does the free discovery phone calls for us. And let me tell you who that phone call is for. Now, you've just seen just a little bit ago, a button popped up over here. It should be up on the right side. That's where it usually goes. And you can just click that button at any point if you want to schedule a free discovery phone consultation. But let me go through and just kind of give you an idea of what it's for. First of all, it's for you if you just need some direction. Maybe you need to ask somebody a few questions and just find out, what do I do? What's the best thing for me to do? What should I do next? It's also for people who are just not sure if our approach is the right fit for you. Everybody is at a different place in their health journey. You're where you are and somebody else is at a different place. And you've got to make sure that whatever it is that you choose to do is the right thing for you. There is no such thing as one size fits all. And, this is where Lenine can talk to you on the phone and give you some ideas. It's about 20 minutes. She sets aside about 20 minutes and sits down. She'll take you through. She'll ask you some questions. You can ask her some questions. She can get an idea of what's going on and maybe even start helping you pinpoint some of the triggers and things that have gone on. And then she'll talk to you about the next steps that you should take. Maybe you should run some labs. Maybe you should come in and we'll do a consult and sit down and see if we can't figure out what your root cause is. Maybe you need to go see a different kind of doctor. But whatever the next best step for you is, she will go over that with you and help you make that decision. Now, if for some reason the little button isn't showing up on the side, you can go here to our website. And you can go on there and let me show you how you do this. But before we do that, I want you to take for a moment and imagine this, that in 2 weeks, the reason I say 2 weeks is because it takes about 2 weeks for most of the labs to come back if we need to run some labs. But let's just say that 2 weeks from today, you know exactly why you have an autoimmune disease. And by knowing why you have it, you know how to reverse it. That's the goal here. Figure out why you have the problem and then come up with a plan on how to take it and reverse it. So let me show you how you sign up. If you click the button or if you go to the website, either one, here's what you'll do. You'll come to our page, our home page, and what you'll see is right up here, it says Schedule Now. And if you will click that button, just go to drgarlandglenn.com, click that button, and here's what happens. You'll come to this page, and you're going to click right here. And right here, it's going to take you over. It says schedule your free discovery call. And when you do that, it's going to bring you to this page here. So what I want you to do is fill in that you're a new patient, and you're going to make a choice here. And what it's going to do, it's going to allow you to come right here to a free telephone consultation. That's what you want right there. So go new patient, then choose the free telephone consultation, and it's going to take you to a page that looks like this. It's going to give you some days of the week and some different times to select as options. And all you do is you just pick one of those times that matches your schedule that's good for you. Click that, and that will get you scheduled for your free discovery phone call. You will get a text from us or an email from us reminding you of that call, and Lenine will call you or one of our team members will call you and go through that free discovery phone call with you. Now, while you're doing that, and go ahead and sign up. There's no obligation, and there is never, ever, ever any pressure to schedule to become a patient. This is strictly for you just to find out more about what's going on and find out if we might be the right place to help you, and maybe find out if you ought to get some labs run. That's always a good thing to do. So while we're giving you some time to do that, let's go over a few of the myths. These are things that I see all the time. The number one myth being people will say, well, I've tried everything. Well, I'm going to tell you this. If you haven't tried functional medicine, then you haven't tried everything. you need to try functional medicine, because that's where we fix the root cause of the problem. The second myth is that if this worked, my doctor would know about it. You know, whenever I hear a statement like this, I come back and I say, you know, there was a time when intelligent people thought that the earth was flat. And when Galileo said that the sun was the center of the solar system and not the earth, he was put under house arrest for the rest of his life. The traditional medical industry is a massive, massive financial industry. And trying to turn this around is like trying to turn an aircraft carrier around, in a little bitty harbor. It's a difficult and process, and it takes a long time. What a lot of people also don't realize is that clinical practice, this was published in by the journal, the Royal Society of Medicine in the UK a couple of years ago. Clinical practice in the internet age is 17 years behind research. And these articles that were first being published about autoimmune disease, showing that the leaky gut and the triggers, they were first published in like 2009 and 2010. And so most of this information has not been out long enough for your doctor to have heard about it. A lot of people think they don't have time. And I want to address that. If you don't have time now, when? Then you need to, when will you have time? Remember this, that autoimmune diseases do not get better with drugs, and they do not get better over time if you don't do something. Also, every time you get an autoimmune disease, your chances of developing another one goes up 300%. That is just huge. A lot of people believe that functional medicine is expensive, and I want to think about it this way. I don't think functional medicine is expensive. What is expensive is being sick for the rest of your life. Do you know that on the average person in North America spends the last 10 years of their life sick? And the fifth myth I want to cover is that you can figure this out on your own. There's an awful lot of information on the internet. It's all over the place. The biggest problem is differentiating between what's true and what's not, what's relevant to you and what's not, and what order to fix things in. Because it's very important not only to identify the root cause, but then you have to know how to fix things and get it in the right order. And if you do 90% of the job, but you're missing a critical factor, then you're not going to, it won't happen. And this is where functional medicine doctors come in, because we are able to mentor people through this process. So the reality is this: if you only use a tiny fraction of what we covered today, I hope that you feel like you've taken a giant leap forward in understanding your condition. Autoimmune conditions are not inevitable. Autoimmune conditions are not lifelong. They can be turned around if you do the right thing. So is it safe to say that you've learned something new and valuable? Type it in the box for me. I like to hear thank you very much. Thank you. And new and valuable information does not change your life. New decisions change your life. And that's what we do, is we help to mentor people through the process of actually fixing these. So if you haven't clicked the button yet and signed up, or if for some reason the button is not working or you don't see it, just go to the website, drgarlandglenn.com, or you can also call the office. I know my mom, she does not like to register for anything online. She wants to call the office and talk to somebody. That's just fine. You can call us at 703-303-8844. That's our office in Reston. Just give us a call, and one of the team members they'll answer the phone. They'll be happy to answer your questions, and they can schedule you for that free discovery phone call. If you'd like to do it that way, that's just fine. Or if you need a time that is not available online, call them, because they can find a spot and set it aside. It might take, might take a few days, or it might be into, let's say, the next week or something, but we'll find a time that fits well for you if you can't fit into the schedule that's there on the website. Or you can also send us an email. You can always send us an email. Send it to support@drgarlandglenn.com, and we'll get back to you right away with any questions that you have. We can get a free discovery phone call scheduled for you that way, or just answer your questions. Also, if you go to the website, I've got other webinars available. There's lots of information and resources there for you. There's some downloads about autoimmune disease, about thyroid disease, and other things like that. And also, I have lots of little information videos and so forth that are on my YouTube channel. Just go to the YouTube and search for me. You'll find my channel. And every Tuesday at 12:30 lunchtime, I do a little 15-minute Facebook Live. And you can go there, go to my Facebook page, Dr. Garland Glenn, and every Tuesday, 12:30, we do Facebook Live, and I have a little topic of the day, and it might be, I've been recently doing some on neurotransmitters, serotonin, dopamine, things like that. I do topics on gluten, on adrenal fatigue, autism, ADD, ADHD for the kids, all kinds of just little short, like little mini webinars on just very specific topics. So you can check us out there. I really appreciate you being here today, and don't miss the opportunity to get that free discovery phone call and just ask some questions. And that'll help to keep moving you along on your health journey. So thanks again for being here. I really appreciate it, and hopefully we will see you soon. And have a great day today. Bye.